So, as you know, the Lancet is a very eminent medical journal, and we were very excited at the opportunity to launch another series on maternal health in the Lancet. The articles were written by 77 academics across all over the world. There were Nigerians involved as well, and for us it was a really important opportunity to update information from a series we had done 10 years ago. And so 10 years ago we focused on maternal death and we focused on poor countries. But in this series we wanted to go universal, and we want to look at low, middle and high income countries and look at maternal health. So not just the deaths, but look at how do we ensure health and well-being for all women.
Okay, we're focusing on family planning. What's your input?
Right, okay. Well, thank you for asking me that question, because yes, what does maternal health have to do with family planning? Well, it's essential. So first of all, we know that in many parts of the world, women don't want any more children, or they don't want any children right then. And for us, this is a really important tool that we have, because if you're not pregnant, if you don't get pregnant, you're not going to die in childbirth. So it's one of the most effective ways of reducing maternal deaths. Yeah? So if women who don't want any more children, families, couples who don't want more children, start using family planning, then they don't face the risk of dying, the women don't face the risk of dying in childbirth. So it's a very cost-effective way. We also know that if women space their births, then that has benefits for their health, but also for their baby's health. So children that are born after a longer birth interval have a much greater chance of surviving those first difficult years of life. So family planning is it's probably the most effective tool we have. And if we could just get people who don't want any more children to use contraception, we could reduce maternal deaths by 1/3. So it's a huge impact. Yeah? So it's essential. Of course, women, families, society needs children too, and that's why we're also arguing that we need to care for the women when they're giving birth and care for their babies in those first difficult days of life. So.
Talking about care for the woman, and for the mother and the child, that brings in the midwife. So what's your thought on that?
So I think, midwives are really a key for, they have an incredibly important role. Midwife, it means with the woman. It's somebody who's an advocate for the woman, who, but also who has the skills and the competencies to prevent complications, to recognize complications early, and to try to help make sure that the woman gets care. So I think midwifery is really the linchpin of maternal health. Of course, we need obstetricians, we need other kinds of health staff as well, anesthetists, but really the midwife is the key person, because they can protect normality and deal with uncomplicated delivery, as well as help ensure that women with complications get moved quickly to more sophisticated care if they need it. So,
one word of advice to Nigeria on the issue of family planning.
Okay, I'll say that very humbly, because I don't know about Nigeria, and one theme we had very much in the series is that one size doesn't fit all and you need local solutions. But I think being in the conference, I've seen amazing young people who are champions, religious leaders who are champions, local and state government who is champions, and I think they need to just act on the commitments that they've made in this meeting. You don't need me to tell you what to do. People here already know, and Nigerians are vibrant, dynamic, clever people, and just go for it. Do what you know you need to do. So thank you.
Thank you very much.
Thank you very much.